Hi there, Akeisha Anderson here, Policy and Advocacy Director for Alabama Arise. Per usual, I am here to provide you with another legislative update. With only 5 legislative days left this session, there is a lot left to get done before the clock runs out. Before we get into what's left to do, however, let's briefly discuss what happened at the State House last week. Last week began with Alabama Rise calling a public hearing in the Senate Finance and Taxation Committee on HB 145. HB 145 is the Education Trust Fund budget. During the public hearing that took place last week, we spoke about the importance of the legislature, including funding for summer EBT for 2025 in the Education Trust Fund budget. Currently, there is no funding for summer EBT for either this summer nor next. Thus, we are trying to do everything in our power to ensure that next summer, the 500,000 kids that rely on school meals don't go hungry during their summer break. We were grateful to be joined by several of our Hunger Free Alabama partners, including Voices for Alabama Children, who testified about the importance of summer EBT last week, and we look forward to seeing what unfolds this week regarding this issue. Last week, we also saw HB 376 by Representative Yarborough pass out of the House Public Safety and Homeland Security Committee. If passed into law, this bill would allow local law enforcement to serve as a proxy for ICE and potentially target and racially profile many of our immigrant neighbors who, while trying to enforce federal immigrant laws. Last week, we also saw SB 91 by Senator Linda Coleman Madison, which would have added an additional license tax fee as a mechanism to fund the Alabama Public Transportation Trust Fund, forgive me. Unfortunately, this bill received a 6-7 vote and thus failed to pass out of committee. Thankfully, however, Senator Coleman Madison has expressed a commitment to come back next year in pursuit of funding for public transit. Last week, we also saw SB 231 by Senator Arthur Orr passed out of the House. This is the bill that would strip companies of tax incentives if they voluntarily recognize their workers' decision to form a union. This bill is one like Representative Yarborough's bill that we are opposed to, and it is now slated to be back in the Senate and to potentially have a conference committee to discuss some of the amendments that were placed on it in the House. Lastly, last week the House and Senate held a joint health committee meeting, which was designed to discuss solutions for closing the health coverage gap. During this hearing, lawmakers heard from both Arkansas and North Carolina legislators, our lawmakers, who shared with our lawmakers details about their quasi-Medicaid expansion plans that have been rolled out in each of their respective states. Last week was a lot. Again, we are racing against the clock, so let's move forward to what's going to be on the tap for this week. This week is slated to be a budget-heavy week. In the Senate, the general fund, a supplemental general fund, a cost of living increase for state employees, the education trust fund, and a supplemental education trust fund will all be deliberated in committee on Tuesday. We are optimistic that Senator Arthur Orr will prove to be a hero to the 500,000 kids that I referenced earlier by ensuring that there is funding for summer EBT in the education trust fund budget this week. Also in committee this week will be SB 312 by Senator Barfoot. This is a bill that will be deliberated by House Judiciary Committee on Wednesday, and if passed, it will give people in prison an opportunity to attend their parole hearings virtually. Lastly, neither here nor there, the Legislative Council will be meeting this Wednesday afternoon to discuss the State House construction project, which is currently underway. My friends, there is quite a bit left this legislative session, quite a bit slated for this week. However, as the clock continues to tick down, I'll be sure to be here to continue to provide you with weekly updates. In the meantime, take care.